Hello, my name is Robert Giuliano, and I'm editor-in-chief of the new Anticoagulation Management clinical community available on CardioSource. Today I'm talking with Professor Tony Dalby from South Africa on a topic of novel anticoagulants. Welcome, Professor Dalby.
Thank you very much, and thank you for having me.
Dr. Dalby, tell us a little bit about the state of oral anticoagulation in South Africa.
Well, our local problems are similar to those seen internationally. A significant number of patients with non-valvular atrial fibrillation, and then a substantial number of patients with valvular heart disease, particularly rheumatic heart disease and valve replacement, and deep venous thrombosis. Our issues here are not so much that we do not wish to anticoagulate these patients, but we need to promote the idea to other practitioners that anticoagulation is not dangerous. In fact, it's beneficial. And many practitioners avoid exposing their patients to anticoagulation when the indications are there, particularly in non-valvular atrial fibrillation. In this country, up to the present, we have had only warfarin as a vitamin K antagonist. And so we get it in formulations of 5 and 3 and 1 milligram. It allows for a little bit of dose variation for those who are sensitive to it. But the real issues are that we need to have people understand the risks that patients are running with non-valvular atrial fibrillation. We need to promote the idea of risk assessment and the proper use of anticoagulation. I think that most practitioners fear that they will cause an intracranial hemorrhage, and everybody knows about that risk. But I think that the counterbalancing benefits of avoiding stroke need strongly to be emphasized. And then when it comes to managing the anticoagulation, we find a lot of erratic behavior in terms of introduction of dose, in terms of maintenance of dose, in terms of responses to when patients have surgery or have a bleeding episode. There are a number of means of which these patients get treated, and it's hardly formalized. And this is obviously worsening the results of warfarin anticoagulation in South Africa.
I see. What's your view on the novel oral anticoagulants that are now becoming available? What do you see as their major benefits and then limitations or challenges compared to warfarin?
Up to the present, we have dabigatran available in South Africa. We get it in formulations of 110 and 150 milligram. And in fact, the uptake has been enthusiastic. The cost is very high in relation to the cost of warfarin. And therefore, this is often resisted by the funders, the state, and what we call the medical aids, the medical insurers. So it's not easy to get for a patient. Unfortunately, my personal experience to date has been that untutored practitioners are prescribing this drug, and I have seen patients who are with non-valvular atrial fibrillation being treated on 110 milligrams daily. I've seen off-label inappropriate use of the anticoagulant, and it's really a big concern. As far as the other oral anticoagulants, rivaroxaban is shortly to be approved in South Africa, and followed hot on the heels by apixaban. These obviously we have little experience with, although we do have rivaroxaban available for DVT indications at this time.
Very good. And looking ahead in 5 to 10 years, what do you see for the future of oral anticoagulation in your country?
Well, I certainly hope that we can understand better the new oral anticoagulants. Many of us who are informed are concerned about the management of bleeding, the issues that might arise from going to elective surgery. And a lot of our surgeons are very resistant to the idea of the new oral anticoagulants, despite the benefits that have been shown. So I think that once we know about effective antidotes, once we know about testing for the activity of these agents, we'll have a better handle on this. And it's my experience within South Africa that we will sit with warfarin for a considerable period before we are freely using these drugs because of the cost constraints, which always within a developing country is a major issue.
Thank you so much, Dr. Dalby, for your insights. And I also want to thank the audience and hope that you will visit the community frequently for ongoing information about anticoagulation management. This is Robert Giuliano for the CardioSource Clinical Community on Anticoagulation Management.